Assalamu alaikum dear students. So today is the last topic of our tooth morphology, that is the anomalies of teeth. Some of anomalies I have taught you in my last lecture. Now we'll start the rest, in which there are these anomalies are more related to other abnormal structures present in teeth. So let's start. Odentomas. Odentomas are basically the calcified structure that is more related to the composed of dental hard and soft tissues, enamel, dentine, and pulp. They are the benign tumors that are present. They can be associated with the tooth or can be present separately in alveolar bone. Odontomas, that are the complex odontomas and compound odontomas. The complex odontomas consist of mass of dental tissues that can be attached to a normal tooth or present separately in alveolar bone. They can present a mass like tumor present in the in the bone, and they may present they give the radio opaque appearance on the x-rays, and they are complex, like they have different shapes. They can be a more or like a spherical type or irregular type, and they are present in the bone or can be attached to the surface of the like root of the tooth के साथ attach हो सकता है. ठीक है. अब compound odontomas क्या हैं? Compound odontomas consist of calcified tissue. In contrast to the complex one, they composed of tooth-like outgrowths. Like इसमें जो appearance है on the radiographic appearance, they give a tooth-like structure, tooth-like appearance. The shape of the tumor is more or less like the tooth. So they have can be mistakenly taken as a rudimentary form of the tooth. ठीक है. So these were about the odontomas. जनरल फीचर्स इसके क्या होते हैं? दे ओडोंटोजेनिक, क्योंकि डेंटल टिश्यू से जो है ये ओरिजिनेट करते हैं. They can cause eruption of the permanent teeth. They may develop as normal dentition starts. They can be equally found in male and female. There is no sex predilection present. They occur more in young age group, and with the average age being the second decade of the life. ठीक है. They more commonly present in maxilla. The compound type is more commonly found in anterior maxilla, while the complex occurs mostly in the posterior region of the jaws. ठीक है. Here we can see the complex and compound odontomas. ठीक, odontomas. This is the complex one. ठीक है. The complex mass is present. A larger mass is present in the alveolar vein, and they are hindering the eruption of this tooth. ठीक है. And compound type is the more or less the tooth-like type. ठीक है. इसमें इतना prominent. This is this one. ठीक है. This one is the compound odontoma. ठीक है. Here you can see this is the compound one and this is the complex one. Understand? Fine. Now we talk about the abnormal calcification and opposition. Basically it has got 3 or 4 types, right? So we call it has enamel dysplasia, in which underlies enamel hypoplasia and enamel hypocalcification. Then we have amelogenesis imperfecta that could be associated with syndrome, that is imperfect formation of enamel that indicates its terminology. So then we have the fluorosis, which occurs due to the, as you all have studied it in your community, due to the increased level of fluoride in the water. And then we have got enamel hypomaturation, hypomaturation, hypocalcified, focal hypomaturation, hypocalcified areas can be present in the teeth. Then we have got Turner's tooth, which is formed due to the injury or trauma to the underlying permanent teeth, and it also gives a focal defect in the teeth. Okay, so these were about the in abnormal calcification opposition, in which there is enamel dysplasia, amelogenesis imperfecta, fluorosis, focal hypomaturation, and Turner's tooth, right? So there are different abnormal calcification that could be associated with enamel or dentine, and the mineralization and the calcification defects can occur. Okay. So enamel dysplasia is the abnormal formation of enamel, which encompasses all the defects that occurs during the development of enamel, and the etiological factors could be the same as I have taught you in the abnormalities, teeth abnormality, that could be environmental, congenital, जेनेटिक, जब आपकी जीन्स में कोई वो हो लाइक MSX और ये सारी जीन that is involved in the development of tooth, that misspellings of the genes can cause the abnormality in the teeth. And environmental defects like any disease or any infectious disease can also cause the developmental anomaly in the teeth. Pollution can cause the defects in the formation of teeth. There are several factors that you can quote for the etiological factor of the teeth: the nutritional deficiency, metabolic disorder, and growth hormone deficiency can cause abnormal tooth formation. And there are certain other factors like injury to the permanent tooth bud, and there could be radiation therapy या कोई drug induced हो, tetracyclines वगैरह, that can cause the abnormal teeth formation या discoloration of the teeth, that can cause fluorosis, as the fluoride incorporation can cause the defect in the teeth. So these are the different etiological factors which most of the students haven't mentioned, or they were deficient in their answers. So please do study, do search, har jagah available hai. There is vast information you can get from the web, and you can also quote from the books. ठीक है? The ridges and pits and discoloration is also an example of enamel dysplasia. ठीक है? Then we will move towards the amelogenesis imperfecta, there is in which there could be the absence of enamel, or or if the enamel is formed, it failed to mature. It is very susceptible to caries, but mostly it occurs in the primary teeth, the rampant caries, and then rarely occurs in the permanent teeth. I guess it is associated with ectodermal dysplasia. Ectodermal dysplasia जिसको होगा उसके साथ multiple features होंगे, like उसके hair growth, hair follicles भी नहीं होंगे, उसके बाकी जो है ectodermal जो organs है that would be absent or defective, और साथ ही साथ जो ectodermal formation, that is enamel, that would also be defective. So it occurs in ectodermal dysplasia, right? Amelogenesis imperfecta ectodermal disorder type होता है, that could be hypoplastic, hypocalcified, and hypomaturation type. ठीक है? This is enamel hypoplasia. You can see there is defective enamel formation, softened enamel is present, and it occurs when there is defect and enamel matrix formation, right? So now we will talk about the hypocalcified enamel. This is a picture showing the hypocalcification. There are different hypocalcified areas present. You can see the pitted enamel is present, which is the enamel over here is softening and is susceptible to caries. In this structure, the enamel matrix is formed normally, but the the maturation didn't complete. The maturation process is defective. The mineralization is defective. So you have studied it in your enamel chapter, the enamel lamellae, enamel defects. They are all the enamel tufts, enamel lamellae. They are all the example of these hypocalcified areas in enamel. ठीक है? So this is, now we will talk about the dental fluorosis. As you all know, it is caused by the increased level of fluoride in water. There are certain areas in the village and here in Pakistan that that the water contains high level of fluorides. And the fluorosis, the patients with having fluorosis, the teeth are resistant to caries, but they have got chalky white appearance like this. Chalky white appearance in the teeth. Chalky white appearance is present on the teeth. That is the low level of fluorosis, and it could get pigmented. Brown pigmentation can occur in these teeth, and there is defect. The defect occurs here in fluorosis in the maturation process. The mineralization process is defective, and these teeth are strongly of aesthetic concerns for the patients, and they came to and for this treatment, in which we give veneers or crowns for these. We recommend veneers or crowns should be placed for these type of teeth, right? So the main concern of the patient is their aesthetic appearance, and they are strongly resistant to the caries, and which is an opposing property than the other enamel defects, right? Enamel hypomaturation, that is the focal hypomaturation, that are opaque areas that appear on the tooth surface. On the tooth surface, they are circular in shape, and they are hypocalcified areas and are susceptible to caries. These hypomaturation areas, as the name indicates, the defect occurs in the process of maturation. The enamel is soft in this area, and they are of aesthetic concern for the patients, right? Turner's tooth. It is also an example of enamel hypoplasia. It is a type of enamel hypoplasia which involves a single tooth. The etiological factors are the periapical inflammation of the deciduous tooth, which affect the underlying permanent teeth, and it could result from the extraction of a deciduous tooth, which can disturb the dental follicle of the underlying permanent teeth. So, as I have told you in the deciduous extraction, that care should be taken not to hinder with the permanent underlying tooth bud, and care should be taken during the extraction of a deciduous tooth. So it is also here is the picture showing the Turner's tooth in the anterior teeth, right? Most defects, as we have studied, they are concerned with the anterior teeth mostly, right? Dentinal dysplasia, as the name indicates, it is the defect of dentine that occurs during the calcification process or the matrix formation of the dentine. The dentinal dysplasia is same as that of enamel dysplasia, but the defect the defect occurs in dentine. The defect that occur in dentine is during the histodifferentiation and the calcification process. They disturb the matrix formation or the calcification process of the dentine, right? Administration of wide range of antibiotic tetracycline may impart the color change to the intrinsic color change to the dentinal tissue. The tetracycline, if it administered to the mother or the infant, may impart the color change to the underlying to the permanent or deciduous tooth. That is, they can form the grayish or brownish colored appearance teeth. Here you can see these are the tetracycline staining that appears grayish or brownish gray in color. So these tetracycline stains, they are basically dentinal defect that intrinsic color change occur in the dentinal tissue, and they appear brown or grayish color. The defect occurs because the defect occurs in the dentinal tissue that is undergoing mineralization process. ठीक है, मिनरलाइजेशन प्रोसेस में जो टूथ जा रहा होगा उसके डेंटिनल टिश्यू में ये टेट्रासाइक्लिन स्टेन्स इनकॉर्पोरेट कर जाएंगे और वो फिर ये इस तरह के एस्थेटिकली जो पेशेंट्स होते हैं वो अक्सर एस्थेटिक का उसको उनको कंसर्न होता है. There is we advise them to make full veneer crowns उनको लगा देते हैं. There was a friend of mine जिसको ये tetracycline stains थे तो उसने फिर 6 veneers लगाए थे. So it depends on the extent of the antibiotic therapy or the period of the antibiotic therapy that is going on and to which extent it could damage the teeth it goes on. ठीक है, शुरू में इनका कलर येलोइश होता है, फिर with the passage of time ये ग्रेइश ब्राउन इन कलर जो है वो कन्वर्ट हो जाते हैं, ग्रेइश ब्राउन इन कलर में वो कन्वर्ट हो जाते हैं. ठीक है. Dentinogenesis imperfecta. It is the defect of dentine, as the name indicates. Then it occurs from the genetic disturbance in the dentine formation. So the genes which are responsible for the dentine formation, a minute change in the genes can occur the defect, right? The genes are very programmed in our body and they are specified for the specific function. So the minute change even in the spelling of the genes can result in the anomaly. जो अल्लाह ने हमारे लिए जीन्स हमारी बॉडी में बनाए हैं, they are very specific, they are very programmed, और a minute difference in that can result in the anomaly. For example, जो hypodontia है उसमें भी एक स्पेसिफिक जो जीन रिक्वायर्ड होता है उस टूथ की बट फॉर्मेशन के लिए वो एब्सेंट होगा या उसमें कोई डिफेक्ट होगा. सो दे आर वेरी प्रोग्राम्ड. सो the genes that causes the histodifferentiation or the calcification process of this dentinogenesis imperfecta may get defective and they result in dentinogenesis imperfecta. हमारे पास dentinogenesis imperfecta की 3 टाइप्स हैं. Type 1 that is associated with the bone defect. ठीक है, बोन डिफेक्ट के साथ एसोसिएटेड, दैट इज ऑस्टियोजेनेसिस इम्परफेक्टा के साथ ये एसोसिएटेड होता है जिसमें हमारे पास बोन डिफेक्ट भी प्रेजेंट होती है. साथ साथ डेंटिनोजेनेसिस इम्परफेक्टा के साथ साथ बोन डिफेक्ट भी होती है, ऑस्टियोजेनेसिस इम्परफेक्टा होता है उसके साथ. ठीक है, दैट आर टाइप 1 इज एसोसिएटेड विद द ऑस्टियोजेनेसिस इम्परफेक्टा एंड टाइप 2 इज नॉट associated with the osteogenesis imperfecta. It occurs independently. और dentinogenesis imperfecta होता है लेकिन वो independent होता है, that is not associated with osteogenesis imperfecta. ठीक है, तो टाइप 3 हमारे पास dentinogenesis imperfecta है, that is like type 2 बट इसमें क्या होगा, हमारे पास टूथ के क्लिनिकली टीच के जो है मल्टीपल पल्प एक्सपोजर होते हैं, मल्टीपल पल्प एक्सपोजर उसमें प्रेजेंट होते हैं, ठीक है। So these dentinogenesis imperfecta has got three types, and they are autosomal dominant, hereditary, and the teeth having these dentinogenesis imperfecta, they are fragile, they have got weak dentine, they are fragile, easy to break, fragile होते हैं, easy to break होते हैं, and they can be lost easily. एट्रेजन उसमें बहुत ज़्यादा होती है, एट्रेजन की जो कैपेबिलिटी है वो ज़्यादा होती है बिकॉज ऑफ दिस वीक डेंटिन, एंड दे आर they cause discoloration in the teeth, yellowish brownish जो है ये कलर देते हैं डेंटिनोजेनेसिस इम्परफेक्टा, ठीक है। दिस इज ऑल आई हैव टॉट यू, डेंटिनोजेनेसिस इम्परफेक्टा टाइप 1 टाइप 2, ठीक है। परमानेंट डेंटिशन में ज़्यादा होता है। फिर उसके बाद हमारे पास जो टाइप 3 है, क्लिनिकल प्रेजेंटेशन, एडिशनली इट शोज multiple pulp exposure in deciduous teeth. Now thank you all for listening me in the tooth morphology. Finally it's over. So I put this picture for you guys, and I hope you all have understood exam के बताओ सो बिल्कुल हम शर्मा वाला ना कहे, and I hope you will now study. It's time, date sheet भी आ गई है, so केयरफुली डू द असाइनमेंट्स एंड डू टच इन योर, क्योंकि ये अगर आप लोग छोड़ देंगे आप ओरल बायोलॉजी तो आपसे भूल जाएगी। आप इसको पढ़ें, अपना स्केजुअल बनाएं सब, और दिल लगा के पढ़ें, क्योंकि ओरल बायोलॉजी इज़ वेरी वॉलेटाइल, ये बार बार भूलती है, स्पेशली टूथ मॉर्फो, ठीक है। बेस्ट ऑफ लक फॉर ऑल ऑफ यू, एंड डू स्टडी एंड कीप इन टच। ओके, बाय।